With that, we are going to begin a round of 5-minute questions. I again ask my colleagues to keep track of the clock and stay within those 5 minutes. And I will begin with Dr. Prinstein. And you know, as we all know, the last 2 years have been incredibly difficult in so many ways, but especially on children and in youth. They've faced huge disruptions in their own lives. They've lost loved ones, including their parents. They've missed out on invaluable time with their friends and teachers, and it's become so dire that some of our leading experts have declared a, quote, national emergency when it comes to child and adolescent mental health. You know, as a mother myself, a grandmother, and as a former preschool teacher, I'm really worried about our kids right now. And we just heard very compelling story from one of them. I know parents from my home state of Washington all the way to here to the Capitol are really concerned about this. And I think it's really important to address the effects of trauma, substance use, grief, and other stressors on our kids. And I wanted to ask you today to talk with us about the best practices for identifying trauma and other stressors among our children.
Thank you. We have a number of assessment tools that we can use to screen kids and to understand what their experiences may be, or even before they experience a crisis. We need the support to be able to launch those tools and also to do research to examine how we can use technology to really make the most use of the kinds of passive screening or opportunities to intervene and offer mental health tips, anything that we can do. In particular, this is really important when we think about underserved and underrepresented youth. It is absolutely critical that we are discussing mental health in schools, that we are building into our curriculum social emotional competence. We have the tools to build kids' resilience. We just need the opportunity to be able to teach what we know to all of those teachers and counselors and administrators so we can help them to identify kids before they reach a moment of trauma.
Thank you. Dr. Derman, Dr. Goldsby, I want to talk about inequality within our healthcare system. It's really led to disparities in our healthcare access and outcomes and resources, and behavioral health is obviously no exception. When trying to get care, people of color often face systemic barriers and are less likely to complete treatment or even get appropriate services. Individuals with disabilities are 5 times more likely to have mental health needs, often can't find providers to get the care they need. Meanwhile, in our rural communities, we face significant provider shortages, and members of the LGBT community are more likely to experience mental health and substance use disorders. So as this committee now considers legislation to improve mental health and substance use disorder outcomes, we have to do everything we can to address those disparities. So, Dr. Germ, I wanted to start with you. Your work is at a safety net hospital, and you see patients experiencing mental health and substance use crisis. What barriers to care do your patients experience, and how do they impact behavioral health outcomes and access?
Thank you, Senator Murray, for that question. You described a lot of things in your opening statement that are inequitable in substance use and mental health treatment in general. I think largely what many of us as witnesses have said during our testimony so far is that there's a huge inequity in just the workforce issue. Having mental health providers that maybe don't want to work with people with substance use issues, having folks that focus on substance use issues that don't want to work with the mental health aspect of the patient. And so I think that adds a complexity when people want to go for care, that they have to go to many different providers to get the treatment that they need. We need to stop siloing in healthcare in general and in mental health care this distinction that our physical health is separated from our mental health. So we see often that people get lost because they go from one provider to another trying to get the treatment they need and deserve, and they can't find one provider to do all of those things. The second thing I'll say is that just in general, getting access to care is very hard for our patients. There are a lot of barriers when we start thinking about what substance use treatment programs only want to give medication versus thinking about other psychotherapeutic interventions. How people get into treatment is very difficult. Sometimes, unfortunately, providers will say, well, you need to go to the emergency room intoxicated to get a detox bed. If not, they're not going to accept you. This is the reality of how patients get treatment in the system. because of bed availability, because of the way reimbursement happens, because of the way insurers operate. And last but not least, I do want to think about how do we think about substance use in general, the inequity in that I think it's probably the only disorder that we consider a crime. You can get stopped, you can get pulled over for simply using or possessing this, and we don't treat it like other mental health or physical health issues. I do believe it is a brain illness. It's chronic, it's relapsing and remitting, and it deserves the full treatment like anybody with diabetes, hypertension, or any other condition.
Thank you. And I am out of time, so Ms. Goldsby, I'm going to come back to you on, if I can, later on to ask you that question, and I'll turn it over to Senator Murkowski.